Hi, my name is Salma McKinney. I'm in BSN 346, Section 5. This is a continuation of my prenatal education video discussing about certain precautions a patient should stay away from or consider throughout their pregnancy journey. So here we are with our patient. Hi Debbie, my name is Salma. I'm going to be your nurse for today. Welcome back. We're continuing on your education throughout your pregnancy journey. And these are just certain precautions you should take in consideration throughout your day-to-day life during your pregnancy journey, okay? So we're going to hit a variety of topics. Please stop me or ask me to clarify if something doesn't make sense or you just need to understand it in a different way that I can word it for you, okay? All right. So our first topic is going to be certain specific foods that you should avoid while you're pregnant. So the first one I want to state is certain cheeses. So certain cheeses such as those that are have molds, such as brie, or those that contain goat milk, along with blue cheeses. The reason why you want to avoid those cheeses that have mold is that you run the risk of getting listeria, which is a bacteria that can affect the baby developmentally and just cause birth defects. You can eat other cheeses, hard cheeses. You just want to make sure that these cheeses that you're eating are made from pasteurized milk. That runs a low risk of getting listeria. Another food group that you want, not group, but another food item you want to avoid is raw or uncooked eggs. So you run the risk of getting salmonella. And that's not, if you ever had salmonella, you don't want that for your baby either. Another food group is raw or undercooked meats. So that you run the risk of actually getting a parasite, which is called toxoplasmosis. That parasite is from undercooked meat or raw meat, and that can travel to the baby and cause complications as well. So we got the meats, we got the eggs, other little foods such as prepackaged salad, sushi, that runs the risk of also getting listeria. And you also want to avoid liver and liver products. That contains a high amount of vitamin A, and believe it or not, a lot of vitamin A can be unhealthy to your baby. So those are a couple of foods. Now that we kind of discussed that, we're going to go into over-the-counter medications. So over-the-counter medications, yes, you're going to want to take some to control the pain, to control the constipation. Maybe you might even have a cough or a cold when you're pregnant, and that's fair. So for if you ever feel constipated, it is okay, or just an anti-acid reflux, you can take some Tums. That is okay. You can also take some Metamucil when you're pregnant. That relieves the constipation, some extra fiber. Do the brat diet to relieve the nausea and vomiting. Some other over-the-counter medications for pain. You're going to get that back pain. Totally understandable. Tylenol is the way to go for either a headache or to relieve that pain, that mild pain. Another one that you can take for allergies. So we're moving on to allergies. You can take some Claritin or Benadryl. That is okay. And then finally, for a cough or cold, I just recommend using the Vicks Vapor Rub, kind of to just stop the congestion. Cough drops. Those are good too for the cough. I would kind of put a pause to the cough medicines. Don't really see. I wouldn't recommend the cough medicines for now. That's that until your provider gives it a go. Some of the over-the-counter medications that I want you to steer away from, though, are NSAIDs. NSAIDs such as ibuprofen, Aleve, and aspirin. So that actually causes kidney problems to the baby, to the fetus. So don't want to do that. And then supplements. So supplements are a great way to kind of fill in that gap of nutrition that you need. So some people are naturally just low in iron or can't get the folic acid that they need in their body. Folic acid, you want to make sure you take the necessary dosage to prevent neural tube effects. Iron to prevent being anemic, and to provide enough blood to the baby to prevent low birth weight. Yeah, those are some supplements you want to take. Oh, and iodine, that prevents brain and nervous system um, to not be disrupted during development. And that's pretty much for over-the-counter medications. Moving on to environmental factors. So 4 environmental factors you want to consider. So the first one, lead. Lead can be found in paint or even some water sources. So that can actually increase your risk of miscarriage or cause your baby to be born small. The second one is going to be mercury. Mercury is found in large predatory fish. So that can actually cause birth defects in the brain and the nervous system. So you don't want to be exposed to mercury. Third one is going to be the tobacco smoke. So we do want to avoid tobacco smoke because that actually increases your risk for low birth weight baby. And then finally, I remember pesticides. So pesticides are commonly found in household products. That actually also increases your risk for miscarriage as well. So those are 4 environmental factors you want to consider in your day-to-day life. And then speaking about the tobacco smoke, we'll discuss about how tobacco, alcohol, and other illegal substances are bad to take during just have negative effects during pregnancy. So for the first one, tobacco, like we said, tobacco, if you were to smoke, that causes, again, like I said, low birth weight, increased risk of miscarriage. That causes several forms of cancer, as you know, not to you. So it's just not beneficial to yourself and to the baby. The second one is alcohol. So alcohol, there is no safe range of taking. There's no safe dose of alcohol to take that will just prevent your baby from having any birth defects. So alcohol gets in your blood. That blood eventually goes into the baby through the umbilical cord. And alcohol causes a several amount of birth defects. One known as the fetal alcohol spectrum disorder. So that causes several birth defects when a baby is born, and it just disrupts from the baby developing. And then finally, illegal substance use. So illegal substances to include cocaine, heroin, methamphetamines. If you were to use those while you are pregnant, your baby can become addicted to those, and they must go through withdrawal. Not only that, but just it increases your risk of having HIV or getting HIV if you were to be using substances by injecting yourself with needles. And yeah, we covered the 3. Moving on to travel precautions. So for when you're traveling, it'll be inevitable. You either have to travel for work or for family. That's totally okay. So the best period of pregnancy to travel, I've heard and recommend, is the second trimester. You are at your best, you're more comfortable. Of course, airlines allow you to fly until you're 36 weeks pregnant. However, that just runs the risk of just uncontrollable blood pressure, high blood pressure, and just having the risk of going through preterm labor. When you're in your third trimester, you want to keep it between a radius of 300 miles from where you're at, just in case an emergency were to happen. Either if you're flying or driving, there's going to be a prolonged risk of sitting. So prolonged risk of sitting reduces blood flow to the legs. That can cause blood clots and just not good symptoms for you in general. So avoid prolonged sitting either by wearing support pantyhose or by walking up and down the aisle in the airplane or just stopping at rest stops when you're driving. And limit your driving to 5 to 6 hours a day, no more than that. And then prepping. So prepping for your trip. You want to make sure you have a record of your medical, a copy of your medical record. Also kind of just, you want to Google search a couple medical facilities or just hospitals in that area that you're going to, so you're familiar of where to go just in case an emergency were to happen. Kind of do just a refresh or a review of what your insurance covers if you were to go to that specific city. And I would also pack prenatal care or prenatal vitamins for 2 to 3 days extra, just in case your flight were to get delayed or an emergency happens. And places to avoid. So places to avoid, I would say, is areas of high altitude. High altitude, places where there's a high risk of malaria. Those are the two areas that I would avoid of traveling in general. And that's pretty much it for travel. And then finally, moving on to our last topic is dental care. So for your dental care, your oral hygiene, I would recommend to get an oral exam either early on in the pregnancy or before you're pregnant. Reason being is that if you tell them you're pregnant, they're going to not fully support getting an x-ray just to reduce the radiation going into your belly. However, if you do need treatment, if it's early on in the pregnancy, it is okay because it won't do much. It won't do not much, but it won't affect the baby because the baby is so small. But it does depend the amount of radiation that goes in your belly. So learning or developmental disabilities can occur if just the right amount of radiation hits your belly. So just keep that in mind. If you were to need a procedure to be done, the best weeks to do that is 14 to 20 weeks, just because sitting in that dental chair higher than 20 weeks is going to be very uncomfortable, the bigger you are. And then common things that happen in your mouth when you're pregnant. Your taste buds are gonna be different, and some women get pregnancy gingivitis. It's when your gums get really red and swollen. It can actually cause an infection if not treated right with great oral care. So you're going to be eating more. You're going to need to take care of your oral hygiene much more, not only for you, but for the baby, because we don't want to run an infection to them, okay? Well, we covered several topics that discuss precautions throughout your pregnancy journey. But anytime you need to talk or you have any questions, please don't hesitate to call us. We're with you on this journey, okay? All right, Debbie. And that concludes my skill.